Good evening. My name is Jason Lake with Lumiere Medical, and I want to thank you for taking the time to join us this evening for the TriPollar webinar with Dr. David Goldberg. A few housekeeping notes before we get started. All the microphones are muted, and if you'd like to ask a question to Dr. Goldberg, please write it into the question box at the right of your screen, and we'll answer the question following the presentation. And with that, let's begin discussing the TriPollar technology. TriPollar is the world's most advanced radio frequency technology. It's been FDA cleared since last November for the non-invasive treatment of mild to moderate facial wrinkles. This is a third-generation technology. Some of its predecessors you might know being monopolar devices, and then going from that to bipolar devices, and then finally ending up where we are now with TriPollar RF. It's clinically proven and used successfully by over 3,500 physicians around the world, and it's been available in the U.S. Since late February of this year. The Apollo regenerates collagen, tightens and tones the skin, improves the appearance of cellulite, and reduces body circumference. It's for use on both the body and on the face. So how does the TriPollar RF technology work? It works by simultaneously heating deep and superficial skin layers. It stimulates natural skin renewal processes, tightening existing collagen fibers and augmenting new collagen generation. It also causes the fat cells to shrink, improves the cellulite appearance, and reduces circumference in the abdomen, arms, flanks, and thighs. With that quick overview, it's also a patented technology. The RF energy is delivered between either 3 or 6 electrodes, depending on the handpiece that you're using. It's got a high power density into the dermis and the hypodermis for volumetric heating. The penetration depth is controlled and limited to the treatment area only. So it's a very focused treatment, only really heating up the areas where the paddle is directly in contact with the skin. The TriPollar RF is proven clinically to simultaneously and homogeneously heat both the superficial and deep layers, resulting in collagen remodeling and fat reduction. With that, I'd like to hand it over to Dr. David Goldberg, owner of Skin Laser and Surgical Specialist with offices in New York City, New Jersey, and Boca Raton, Florida. Dr. Goldberg.
Thanks a lot, Jason. Hi, everybody, and good evening. So, as Jason said, I'm going to talk about the Apollo tonight, which really is revolutionary radio frequency technology. As we've lived over the last decade through the various different versions of radio frequency, this one takes a quantum leap. And it takes that quantum leap because it's powered by the TriPollar technology system that I'm going to describe to you. Next slide, Jason. So, you know, on the one hand, this is relatively new technology, and on the other hand, it's not. This technology has been used all over the world. It's just relatively new in the U.S. And there have been a lot of great publications already on the technology, some of them in the journal that I'm actually chief editor of, and that's the Journal of Cosmetic and Laser Therapy. So it's been used for skin tightening, and that's really what I'm going to address tonight. But also, it's been used for the treatment of acne, a whole variety of facial and body aesthetic treatments. There have been studies done both in human skin, clinically as well as experimentally, looking at localized fat reduction and anti-aging. The technology has been used for stretch marks, which is really a difficult problem, and there's some evidence to show this. The Apollo works quite well in that. As I said, there have been clinical studies, but there have also been biopsy studies published going all the way back to 2009 now, so 3 years ago, and on and on and on. So if I could have the next slide, Jason. So what's neat about this technology and the key benefits related to Apollo and its TriPollar technology are that you get to see immediate visible results and long-term results. And the immediate results are important because patients come in, they're paying for this, it's a series of treatments, and they want to see something right away. It's almost like fillers. When we put them into the skin, they see results right away and they feel better about it. But what's great about the Apollo is you not only see those immediate results, but you continue to see improvement with new collagen formation over the course of months after the procedure. Unlike some of the older radio frequency treatments, which really hurt, this really feels like a warm massage. It's pretty easy for the providers who are using it, and the patients all tend to love it because it just doesn't hurt, even when you're dealing with thin, sensitive, or loose skin areas. It clearly fits into the realm of non-invasive technology. There's all this interest now in non-invasive body contouring. It's simple, it's quick. It certainly is the kind of procedure where People can come in, get it done, and go out to lunch or out to dinner. There's no pre-treatment required, and certainly there isn't any recovery time afterwards. Thus far, no burns or scarring. We've never seen any problems with it, and part of that probably is because there are no heating and cooling cycles with it. And as we know with radiofrequency technology, this is colorblind, which means it doesn't matter what the skin color of the individual is. We use this machine, the Apollo, both in our New York and New Jersey offices, but we also use it in Florida, where people are suntan all the time. It doesn't matter what the skin color is. It's safe technology simply because it does not affect pigmentation. Next slide. So here it is. This is the machine. This is the Apollo machine. It's pretty simple. It's very movable. You can see the wheels on it in the slide. And it has 3 different applicators, and it's one of the important things to know about with this machine. It's got an applicator for large areas, which make it so you can move pretty quickly when treating thighs and buttocks. It's got a slightly smaller applicator for medium-sized areas, and then a even smaller one yet for delicate facial areas. So you can treat the thinnest skin areas, such as the neck, and you can go on and treat the butt. And it's simply a matter of using different applicators and applying the energy differently. Next slide. So what's also quite interesting about the Apollo is that it has what's called a lumicam. And this lumicam works as treatment is being delivered, and you can see what's happening with those hot zones, the red zones, which is what we want. It gives the provider, the physician, instant feedback on whether the skin is reaching the desired temperature and maintaining that temperature, which is a little bit lower on the face. It's 40 to 42 degrees centigrade, and a little bit higher on the body because of the thicker skin. And you know it simply by looking at the lumicam, which gives you visual validation for what you're doing. And frankly, it's a great feedback for the patient as well, because they know that what you're doing is actually working. Next slide. So what is it used for, this TriPollar technology that's based in the Apollo? Let's start talking about the face and neck first. It's a common area that we treat. Loose sagging skin is a great indication for the Apollo, and that can be anything from double chin to wrinkles to fine lines near the mouth, eyes, and forehead. And I've used pretty much all the RF technologies out there, and this clearly is one of the easiest and safest to use in these thin skin areas right around the eye. Next slide. The human skin, of course, contains 3 layers, the epidermis, the dermis, and what is known as the hypodermis, or the subcutaneous tissue, subcutaneous fat. The dermal layer, the dermal connective tissue, contains fibroblasts, and these are important structural cells because they maintain skin structure by constantly producing new collagen and other associated structural proteins. That collagen in the dermis is responsible for skin firmness as well as elasticity, the bounciness of skin. Unfortunately for all of us, adult skin loses 1 to 2% of its dermal collagen every year due to collagen fiber degradation, fibroblast-reduced metabolism, all the stuff that goes along with the aging process. And because of that, skin becomes aged, wrinkled, lax, and thin. None of the stuff that we or our patients want to see. Next slide. So when you use the Apollo with TriPollar radiofrequency, as I said, you get immediate results. There's some collagen fiber contraction with the elevation of temperature induced by the handpiece, and that gives you the short-term skin tightening, visible feedback, immediate gratification that people want. And equally, if not more importantly, one sees long-term results with increase in the metabolism of the fibroblasts caused by the thermal effect, and that increased metabolism leads to collagen remodeling, firmer and tighter skin appearance. And you can see that in the slides where the cartoon shows you the tightening of the skin by making it more compact and less stretched out. Next slide. And here you can see on the left, before TriPollar treatment, the skin is sort of a bunch of mountains and valleys, rough and wrinkled as it does get when it's aging. And right after TriPollar treatment with the Apollo, you see less mountains, less valleys, the skin is smoother with fewer wrinkles, and that's the immediate results that I just described. Next slide. If you want to compare what you see clinically and what you see under the camera with what is seen histologically, there is an increase almost of 50% in dermal thickness, focal thickening of collagen fibers, as well as focal shrinkage of fat cells after TriPollar treatments. And this is a study that was published in 2009, so we're going back 3 years ago, by Chaim Kaplan from Israel, and it's the clinical and histopathological results following TriPollar radiofrequency skin treatment. And on the left, you can see that thickening of the collagen. That's a histologic examination. And on the right, you can see a Mason trichrome stain against thickened fibers, and Mason trichrome shows collagen formation. Next. So how do we do it? What's the clinical protocol in the office? It's a course of 4 to 6 weekly treatments. Frankly, sometimes people come in every other week. Ideally, we try to get them in weekly, but it's 4 to 6 treatments to get the ultimate result, and they get that appearance of tighter, firmer-looking skin. As I said, they see results right away, but nothing is permanent. We age whether we like it or not. And I tell people you have to expect to do the 4 to 6 weekly treatments and expect to come in once a year for some touch-ups as they continue to age. Next. So if you look at the left side, you can see the treated side, and you look at the right side that's, you're going too fast, Jason. And you look at the right side that's not treated, and it almost looks like this patient has been given botulinum toxin, which they have not. This is simply the tightening effect on the left side of that patient caused by the Apollo, the TriPollar technology by Collagen after 1 treatment. Next. Here you can see the effect on the neck, the tightening of the submental area, and also on the cheek, the pullback there, and the tightening overall of the face following treatment, again, with the Apollo. And this is Sharon Friedman from Israel. Next. This is a patient of ours, and I tell patients you cannot expect that this is going to be a facelift. It's not. And so, if a facelift is a home run, which in some ways it's not, because they get a facelift look, this is certainly a triple. And you can see the benefit in her neck, her cheeks, the pullback in her cheeks. This is just a really nice result, and this is after an entire series of treatments, in this case 6 times, and just rejuvenated skin. Obviously a very happy patient. Next. This is not mine. This is Steve Shapiro's in Florida. And again, you see that glow that occurs because of new collagen formation being formed. It's not just a matter of the tightening of the skin. Her cheeks don't look like they're as deep as they were after treatment. There's some volume improvement caused by the new collagen formation. But overall, there is improvement in the color of the skin as well as new collagen is being formed. This after 8 treatments. Here you can see on the neck, as I mentioned, thin skin areas respond beautifully to this technology. There are still some lines there, but you can see the tightening. But it's not just the tightening. The overall quality of the skin is improved as well after 6 treatments. Next. Another nice slide. This is somewhat reminiscent of the patient that I showed you that was ours. You can see the improvement in the quality of the skin, the tightening of the skin, just overall healthier looking skin. And people perceive it as healthy looking. They don't perceive it as a surgical result. This is actually after only 1 treatment. Next. Here's after 3 treatments. This is a patient from Paris. And again, that same effect on the jowls, still there, obviously. They're not totally gone, but you can see some tightening. And this will continue to improve as we move out to 4 to 6 treatments, which is the general course of treatment. Next slide. And here you get a sense of the improvement over time, and this is the importance of multiple treatments. There clearly is some tightening occurring after the first treatment, but you get more each time as there's new collagen production formed with each treatment, and this is after 6 treatments all the way over on the right, and obviously tightening and improvement and just overall clinically a nice result. Next. So this is before and now after 8 treatments. So, we generally stop at 6, but nothing says you can't do 8. You probably could do more. There's a certain law of diminishing returns at some point. But this is going to be a happy patient who really has some nice tightening without surgery. Next. So that's the face and the neck. It's a common area that's treated, and the benefits there, again, are the ability to hone in on that thin skin area with a procedure that doesn't hurt, in contrast to some of the other technologies out there that certainly can tighten skin, but are a lot more painful and not necessarily all that safe in thin skin areas. For us, the big area now is off the face. It's body contouring, and that really involves a bunch of different things. It involves the ability to tighten cellulite. Obviously, you can't cure cellulite, it's not a disease, but to tighten cellulite. But more than that, to improve sagging skin on the belly, the thighs, knees, arms, hands, the butt. Sometimes we even do ankles, sagging, bulging skin post-pregnancy or weight loss, bulges in the stomach, thighs, left handles, and arms, and uniform texture and appearance post-liposuction. And I'd add another couple of bullets to this one. One of them is, the perimenopausal stomach that a lot of women get, really treated very nicely with Apollo. And then the other group that we tend to treat is we do a fair amount of laser liposuction, which is not really true liposuction. There's a little bit of aspiration, but it's laser as well. And I find the Apollo really gets them tighter and smoothens them much quicker. So a lot of different applications for off the face. Next slide. So the Apollo system, of course, now is available in the U.S. Before that, it was available in Europe. It's got the CE mark, and the CE mark states that dermatologic treatment system, the Apollo system is for non-invasive body circumference reduction, cellulite treatment, wrinkle, and skin tightening treatment. Next slide. So just like on the face, where we tend to do 4 to 6 treatments, but with a smaller applicator, here you can see the larger applicator, which allows you to treat bigger areas pretty quickly. Once again, a 4 to 6 week treatment protocol, reducing circumference, treating cellulite. Same business as you would expect as on the face. They tend to see something right off the bat, which keeps them coming back, but we tell people they have to have maintenance treatments if they want to have a long-term effect. It's like everything else in life. They can't stop their diet. They've got to stay dieting. They've got to keep exercising, and that applies to this as well. And in some ways it applies to everything we do, whether it's botulinum toxins, fillers. Obviously, there's always going to be some sort of maintenance. Next slide. So this is from Turkey. You can see the nice tightening there, and this is what I was talking about. We do a lot of this. These are women who have had kids, perimenopausal. They're not necessarily all that fat. There's a certain amount of fat there, but you can see the great tightening. And this is, of course, without surgery. So next slide. And then the women's fat pads on the backs. I mean, you're not going to get rid of them by any means, but you can see tightening there as well. Next slide. The arms, the upper arms, this is a uniquely women's problem. What a difficult problem to treat. I mean, in a sense, the best way to treat them, if you want to get rid of all that, is to cut it out. But it's a horror because the scar goes from the axilla all the way to the elbow. Nobody does that. And so people come with very realistic expectations. And you can see the nice tightening that's occurred here after 7 treatments. Pictures from Israel. Next slide. Back to stomach, some nice tightening there. Again, another Israeli set of pictures. And this is an ideal patient. Not a lot of fat, but some lax skin and the ability to tighten that. Next slide. And this is someone that I treated, and she's in pretty good shape to begin with, but you can see some of that stretched skin on her belly on the slide on the left, and we've tightened her very well on the right. Next. It's also someone that we treated who, I want to show you some pictures that are bad, but also you get a lot of people coming in, like on the left where, there isn't too much bad to begin with. What she doesn't like is she doesn't like the fact that her butt is sagging, and you can tell on the right that her butt has been lifted up. So a lot of different ways to use the Apollo device. Here we're just trying to give a little bit of a lift. We only treated her buttock, and we've tightened up her buttock and given her a little bit of a lift. Next slide. Somewhat similar, tightening of cellulite skin, tightening of the thighs. You can almost tell that the medial portion of her thighs are pretty much touching each other before treatment, and then there's that space after treatment as tightening has occurred, in this case after 3 treatments, and I would suspect there'd be more treatment, more improvement after further treatments. Next slide. I think this is important to show you what happens over time. So before, you can see the lax skin on the buttock and the thighs, classic cellulite, aging skin. It's a lot of treatments. This is a Dvorancona from Italy. There's 10 treatments. But notice what happens over time. Because there's new collagen formation for months and months and months afterwards, pretty much we tell people 3 to 6 months from the final treatment will be the final result. So in this case, 6 months after that, you can see the slow gradual improvement. Next slide. Thin skin areas, neck, hands, another great area. And really, there's no other way to treat this, that doesn't involve perhaps injections. And you can see the improvements, still older hands, so easily taken 10, 15 years off her hands after only a couple of treatments. Okay, so we can open this up to questions now.
Yeah, if you have any questions for Dr. Goldberg, please type them into the question box on the right. Looks like you did a great job, Dr. Goldberg. No questions. So I'll just finish it up here. I appreciate you coming on with us tonight, and I'll just finish it up here and do a little bit about the company supporting the device and a little bit to finish up on the Apollo. So as Dr. Goldberg said, the results are immediate, visible results, and also we get the long-term, durable results as well. It's a pleasant treatment. People say it feels like a hot stone massage with no pain, even on the sensitive and loose skin. Non-invasive treatment, walk-in, walk-out procedure. No need for downtime or for any kind of topical anesthesia for pre-treatment. It's a safe treatment for no burning or scarring, no heating or cooling cycles, and it's effective on all skin colors, so it's a year-round treatment. It's easy to learn, easy to use, and it's a safe treatment. The interface is very straightforward. There's defaults on the screen. The training time is very short, and you're able to train your whole staff on how to use it. There's no consumables with this, as there is in other devices. No gels need to be applied to the skin other than a very thin layer of glycerin gel, and absolutely no disposable associated with the Apollo. It's compact and easy to move, weighing only 42 pounds and having about a 16 by 16 footprint. It's a very competitively priced device. It's a high-end device. We're priced very competitively in the market with no recurring cost, and it's a very, very quick return on investment. So if you'd like to contact us for a demonstration or have one of our salespeople contact you, you can reach us at sales@lumieremed.com or reach us by phone at 877-701-2699. And we'll leave this up here for a minute here for you to jot it down. But once again, thanks for joining us tonight, and thanks for Dr. Goldberg for his insight on the Apollo TriPollar treatment.